We heard about it for several months, and then all of a sudden the patients started coming in.
That was quite scary for everyone. No one knows exactly what to expect.
We were starting to talk about shutting down the country to try to limit the spread.
I'm going to be doing an executive order today directing all Floridians to limit movements.
That's when it really started to hit me.
It's out of our books, it's out of everything that we know.
When we first started having my first patient, it was very scary, making sure that I'm wearing the right mask, making sure that I'm actually covered.
What therapies to give, how to deliver them, it's all the things that we're going to need for those patients, and how many rooms will we need.
I hope I'm staying safe for my family.
There's this fear of I'm running into the fire while everybody else is hunkering down.
Many healthcare workers, despite the protection we have, probably expect to get it.
Am I going to take this home to my family? Do I need to be removing myself from my home?
So of course that's our mind every day.
I remember the first patient very vividly. There was so much conversation around it because it was a huge change. The first patient was very scary for a lot of people.
Some seemed fine and very calm, and others you can see the fear in their eyes. And we hit the room. No matter what, we go in and do what needs to be done.
We were still learning as we went. So there's a lot of fear, a lot of anxiety, but also still that calling to do what's right for these patients.
Some patients recover pretty well, some, it takes a little bit longer, but at the same time, we just do whatever they need.
You have to be very loving nature.
All they can see are our eyes. So you have to communicate with your eyes with them to reassure them that you're there for them.
As patient 1 became patient 2 and patient 3, you start to build a little bit of comfortability. So over time, the teams got much more comfortable, but definitely at the beginning, it was a challenge.
I think everyone that's in this together and support each other, they're all heroes.
I appreciate the title heroes. It takes a village.
But if we're going to go through something like this, I want to be in it. I want to be the helper. I want to have an impact, even if it's just a small pillar. I want to be there. It's something that I'm passionate about. That's why I became a nurse, is to help people. And so I wouldn't be anywhere else.
You know what I would tell people about being a respiratory therapist or a healthcare worker? We're there on the worst day of someone's life and the best day of their life, and we know that. And it is a privilege and an honor, yet is just what we do.